Welcome to this explainer, everyone. Today, we are officially launching our QualityPulse series, where we're going to explore the big ideas, the people, and the stories that are actively shaping healthcare quality. I am so excited to jump in because today we are unpacking a concept that literally changed the DNA of how we measure care in every single hospital.
Oh, absolutely. We're talking directly to you, our current and future healthcare leaders, administrators, and clinicians. We are looking at a massive paradigm shift today, so let's just dive right in. Because the entire story of modern healthcare quality actually starts with one remarkably simple question.
Okay, I want you to imagine two different hospitals in your mind. Over here, we've got Hospital A. It's got beautiful, sprawling glass buildings, millions of dollars in the absolute latest state-of-the-art equipment, and a roster of highly trained, famous doctors. But if you look closely, their actual patient outcomes are surprisingly poor. Now contrast that with Hospital B. It has very modest facilities, nothing flashy at all, maybe even a little dated. But it consistently delivers really safe, highly effective care where patients actually get better and go home. Right. So here's the question. Which hospital has better quality? Now, I know it sounds like a total trick question to us today, but for a really long time, the healthcare industry genuinely struggled to answer it. This exact paradox is what led one incredibly observant physician to take a step back and completely reinvent how we define what good care actually means.
And honestly, it brilliantly highlights the dilemma of the era. Up until the 1960s, quality in healthcare was just incredibly difficult to define, let alone put a metric on. I mean, medicine was advancing at breakneck speed back then. We had new antibiotics, the birth of intensive care units, open heart surgery was taking off. But if you asked a hospital administrator how they knew their hospital was actually good, they would almost certainly just point to the shiny new building or that fancy equipment we just talked about.
Exactly. It was all about the optics. Quality was largely assumed. People based it on reputation, the prestige of the medical school the doctors went to, or how expensive the technology was. Sure, good outcomes were celebrated, but there was basically zero agreement on how to systematically measure if evidence-based care was actually being delivered day in and day out. And, as we know, if you can't measure quality, you literally cannot improve it.
So into this wild west of healthcare measurement steps Avedis Donabedian. He was an Armenian-American physician, a brilliant scholar, and a professor at the University of Michigan. Today, he is almost universally recognized as the father of healthcare quality.
And it really kicks off with his 1966 masterpiece paper, Evaluating the Quality of Medical Care. To give you some context, at that time, the federal government was just beginning to throw its weight and its money behind assessing medical care. But nobody had an organized picture of what a quality assessment even looked like. Donabedian stepped in and supplied the nomenclature. He basically gave the entire healthcare field a shared language so we could finally move away from just subjective opinions and start doing systematic scientific evaluation.
But, here is the most fascinating part about Donabedian to me. You hear father of healthcare quality, and you probably expect this cold, calculating, hardcore numbers guy, someone obsessed with spreadsheets and charts. But he wasn't a reductionist at all. Toward the end of his life, he was asked about his life's work, and he famously said, "The secret of quality is love. If you have love, you can then work backward to monitor and improve the system."
Man, I just love that quote. It is so powerful because it reminds all of us that the systems, the metrics, the digital dashboards, they are merely enabling mechanisms. True quality in healthcare requires a deep moral imperative. You have to actually care about the patient first. You have to have that love. And then you let that drive your relentless, everyday pursuit to build a safer, better system around them.
So, that begs the big question. How do we actually build and measure that system? Well, Donabedian gave us a framework that is deceptively simple. It literally fits on a single page. It is the cascading, interconnected relationship between structure, process, and outcome.
Yeah, think of it like the three mandatory questions every single quality leader has to ask. First up, structure. Do we have the right physical environment, the right staffing, and the right resources to even deliver care? Second, process. What actually happens during the interaction between the patient and the healthcare provider? And finally, outcome. Did our care actually make a difference? Did it improve the patient's health? You can't look at one without the others. They are entirely tied together.
Okay, let's pull this out of the theoretical and make it really practical. Let's look at a scenario that quite literally keeps hospital administrators and nursing directors awake at night. An incident report comes in. A patient receives the wrong medication.
It's terrifying. It's the absolute worst-case scenario, but unfortunately, we all know what happens. But here's the thing. How your organization reacts to this specific incident completely defines your culture of quality. We can use Donabedian's three-part model right now as a diagnostic tool to dissect this event and actually learn from it.
Now, the knee-jerk reaction in healthcare for decades was to immediately ask who made the mistake, right? Who was the nurse on duty? Who was the pharmacist? Find them, blame them, punish them, maybe even fire them. And honestly, it's just a very natural human reaction to look for a culprit when things go wrong. But Donabedian challenges us to step back and ask a much better, much broader question. What happened?
Exactly. We have to shift the entire conversation away from blaming one isolated, stressed-out person and instead investigate the underlying conditions that made that error even possible in the first place. Because think about it. If you just fire the nurse, the trap is still there, just waiting for the next nurse to fall into it. So let's work backwards through the system, just like Donabedian suggested, starting right at the foundation.
So we look at the structure first. Remember, this is the environment, the physical facilities, the resources you provide your team. In our wrong medication scenario, maybe we dig in and find that the pharmacy recently purchased two completely different drugs, but they have identical, similar-looking labels. They look like twins on the shelf.
Right, or maybe we discovered that there were severe staff shortages on that specific ward that night, meaning the nurses were covering double their normal patient load. Perhaps a brand new staff member didn't get proper orientation, or the computer information system kept freezing up and crashing. Listen, good structures don't automatically guarantee perfect care, but poor structures, like these, make delivering good care almost impossibly difficult.
Next, we move down the cascade and look at the process failures. If structure is the environment you built, process is the actual workflow, the interactions. In our scenario, because the nurse was incredibly rushed due to that structural staff shortage we just found, the patient's identity armband wasn't checked.
Exactly.
The mandatory double check with a second nurse, well, that was skipped because literally no one else was available on the floor to help. Communication completely broke down during the shift handover. Donabedian always considered process to be the most direct, actionable measure of quality because it is a real-time reflection of what clinicians are actually doing in the moment, including how they are talking to each other. And that brings us, finally, to the outcome. The wrong medication is administered, the patient suffers physical harm, and the family rightfully loses all trust in the hospital. It's a tragedy.
It is. And this right here is the absolute crucial takeaway. If a quality leader or a hospital CEO only focuses on this end result, the outcome, they completely miss the opportunity to actually fix the broken system. An outcome is just a lagging indicator. It's in the past. If you just punish the nurse and you ignore the identical drug labels or the massive staff shortages, I guarantee you, the exact same outcome is going to happen again to someone else next week.
And that shift, that massive foundational shift in thinking, is exactly why Donabedian's model is still the absolute bedrock of medical quality management today. I mean, just look at the cover of the American College of Medical Quality's official textbook here. You literally cannot get a master's degree in healthcare administration or become a certified quality professional without studying this exact framework inside and out. The entire modern discipline of quality improvement completely relies on this interconnected triad: structure, process, and outcome to drive any sort of meaningful, lasting change. So what we are really talking about here is moving an entire industry's mindset. On one side, you have the old punitive way of managing incidents. The old way simply asks, who made the mistake? It isolates individuals.
And on the other side, you contrast that with Donabedian's vision, actually improving quality. It's proactive, it's systemic, and it asks what in our system allowed this to happen. It transforms a hospital from a culture of fear, hiding, and blame into a culture of continuous learning and genuine patient safety.
Now you might be sitting there thinking, well, I walk the wards every day and I don't exactly hear people shouting Donabedian's name in the hallways. And fair enough, but I promise you his DNA is in everything you do. Every single time your hospital goes through a grueling accreditation visit, whether that's Joint Commission International, JCI, or NABH, what are they doing? They are meticulously looking at your structures and your processes.
Oh, absolutely. Think about your patient safety programs, your routine clinical audits, the quality indicators you report on, and those fancy real-time digital dashboards tracking your readmission rates. They are all built entirely on his framework. If you are tracking a metric right now in your hospital, you are essentially tracking a structure, a process, or an outcome. Even when his name isn't spoken out loud, healthcare professionals are using his exact mental model every single day to evaluate care.
It's true that healthcare today looks vastly, vastly different than it did back in 1966. We have robotic surgical systems, global telemedicine, AI-assisted diagnostics, and genomic medicine. But even with all that sci-fi tech, this core principle still holds completely true. Outcomes must always be interpreted alongside the structures and processes that produce them. That's spot on, because it doesn't matter if you are using a basic wooden stethoscope or a multi-million-dollar advanced AI algorithm. Excellent patient outcomes are rarely just lucky accidents. They are always built on strong, resilient systems that deliver reliable, evidence-based care. The tools we use have evolved tremendously, but those underlying questions about our structures and our processes, they haven't changed one bit.
So, as we wrap up this explainer, we really want to leave you, our current and future healthcare leaders, with a challenge. Consider this a moment for a little Socratic reflection. The next time a patient complaint crosses your desk, or you have to review a critical incident report, which question are you going to ask? Are you going to take the easy road and ask who made the mistake? Or will you take a breath, look a little deeper, and ask what in our system allowed this to happen? Because choosing that second question, the Donabedian question, is the true difference between simply managing incidents and genuinely improving the quality of care you provide. This has been Quality Pulse, where we explore the ideas, people, and stories that continue to shape healthcare quality. Join us next time as we look at how Toyota transformed manufacturing and why hospitals around the world began paying attention. Until then, remember, quality isn't about perfection. It's about building systems that help ordinary people consistently deliver extraordinary care.